Dignity is about small things that are extremely important. Good practice in toilet management and continence promotion can help people maintain their dignity. Ensuring people have privacy when using the toilet is crucial. Before starting the activity, read the handheld record for a recent update on how the person has been managing and if there have been any issues highlighted by their carers, for example, skin issues or falls. Check how the person transfers and mobilises. Do they use a walking aid? Has an OT or physio written any guidance relevant to the task? For example, standing to complete the task, or person does part of the task and then the carer takes over. At all times, respect the person's wishes and include them when planning the activity, always inquiring as to what they feel able to do. Prompting. Some people may need to be prompted to go to the toilet, particularly if they have trouble remembering, learning new things, concentrating, or making decisions that affect their everyday life. This is called cognitive impairment. A simple reminder may be all the support they need. Some people might need more help when in the bathroom if their balance or mobility is limited. They may also need help with undoing buttons or removing items of clothing. When you get to the toilet or commode, remember your handling and moving techniques. Most people like a regular routine for going to the toilet, so allow plenty of time, and if it feels safe to leave the room, ask the person to let you know when they've finished and they're ready for you to help again. Helping going to the toilet will vary depending on the person's ability. For example, standing, cleaning, help with clothing. Please refer to the handheld records. Please note, when supporting a female to wipe, this should be from front to back to prevent infection. Offer to put washcloths and towels in the washing machine before removing PPE, washing hands, and appropriate disposal of PPE. Incontinence pads. There are products to help the management of urinary incontinence, such as pads. The person may have different pads for day and night, so please check the handheld record. Some people have a urinary catheter. If you're visiting someone to empty their catheter bag, you will need to wash and dry your hands thoroughly and apply PPE before removing any straps attaching the bag to the person's leg.
Okay, so we're ready for your catheter bag to be emptied now. That's great. Okay.
Point the urine outlet of the leg bag over the toilet, if mobility allows, or over a clean container, making sure that the outlet doesn't come into contact with anything. Open the tap to allow urine to drain out of the bag. Close the tap when the bag is empty, using a clean tissue to dry the end of the outlet. If the urine was emptied into a container, pour it into the toilet, then clean the container.
So you ready for me to empty your catheter bag and pop your night bag on? Mm-hmm.
Please note and record the colour of the urine. If the person is drinking enough fluids, the urine should be straw coloured. Remove and dispose of your PPE appropriately and wash hands. Encourage fluids and ensure the person has access to drinks before you leave.